Weather affects COVID-19. How? Research shows there are more COVID-19 cases as temperature and humidity fall. A recent study points to more severe cases in cold and dry weather. Do these findings suggest COVID-19 is seasonal? Experts disagree. Why are these findings so controversial? And why has the United States seen most cases during its hot and humid summer? In this special feature, we investigate which weather conditions are most associated with COVID-19 cases. We look at what factors might confound these studies and make them hard to interpret. And we describe how one international study tries to get around these problems. There are good reasons to expect a respiratory virus to show seasonal variation. Infections from influenza and respiratory syncytial virus are more common during winter in temperate areas of the world. Studies of the first SARS-CoV in 2003 suggest weather might be important for coronavirus spread. While this virus did not circulate long enough to establish any potential seasonal pattern, daily weather was associated with the number of cases. In Hong Kong, new cases were 18 times higher in lower temperatures, under 24.6 degrees Celsius, than more elevated temperatures. The epidemic died out during a warm, dry July in 2003, but tight public health control measures are also in place. A recent review of the seasonality of respiratory infections describes how cold, dry winter weather makes us more susceptible to viruses in general. In these conditions, the mucus lining in our noses dries up, which in turn impairs the function of cilia, the tiny hairs that line the nasal passage. This beat less often, meaning they may fail to clear viruses from the nose. The review concludes that a relative humidity of 40 to 60% might be ideal for respiratory health. Americans spend 87% of their time indoors. So how does the outside weather affect them so much? When cold, dry air meets warm air from indoors, it reduces the air's humidity inside by up to 20%. During winter, indoor humidity levels are 10 to 40% compared to 40 to 60% in fall and spring. The lower humidity aids the spread of virus aerosols and could make the virus more stable. Humidity and rainfall. Laboratory and observational studies of cases of COVID-19 patients show an impact of humidity on the SARS-CoV-2 virus. A laboratory generated aerosol of SARS-CoV-2 was stable at a relative humidity of 53% at room temperature 23 degrees Celsius. The virus had not degenerated much even after 16 hours and was more robust than MERS and SARS-CoV. This helps explain its higher levels of airborne infectivity. Laboratory studies do not necessarily predict how a virus will behave in the real world. However, a study of 17 cities in China with more than 50 cases of COVID-19 found a link between rises in humidity and reductions in COVID-19 cases. The team measured humidity as absolute humidity, or the total amount of water in the air. For every gram per cubic meter increase in absolute humidity, there was a 67% reduction in COVID-19 cases after a lag of 14 days between the humidity increase and the number of cases. Experts report similar associations between the number of cases and humidity in Australia, Spain, and for both cases and deaths in the Middle East. The way temperature and humidity interact provides different weather patterns which are determined by latitude. A comparison of climate data looked at 8 cities with high levels of COVID-19 spread: Wuhan, China; Tokyo, Japan; Daegu, South Korea; Qom, Iran; Milan, Italy; Paris, France; Seattle, United States; Madrid, Spain. These cities are compared with 42 other cities worldwide with a low COVID-19 spread. All of the first 8 cities lay in a narrow band between 30° north and 50° north latitudes. Between January and March 2020, the affected cities had low mean temperatures of 5 to 11 degrees Celsius and low absolute humidity of 4 to 7 gram per cubic meter. The authors conclude these findings are consistent with the behavior of a seasonal respiratory virus. Studies of influenza show tropical areas where rainfall drives humidity have a higher transmission in humid, rainy conditions. American researchers established a threshold of 18 to 21 degrees Celsius and specific humidity approximately 13 to 14 gram per cubic meter for increased winter transmission. Tropical countries with temperature and humidity levels above this had higher influenza transmission when rainfall was high, defined as greater than 150 mm per month. Brazilian researchers looked at rainfall worldwide and confirmed COVID-19 cases also increase with greater precipitation. For each average inch per day of rain, there was an increase of 56 COVID-19 cases per day. No association was found between rainfall and COVID-19 deaths. Temperature. Links between COVID-19 cases and temperature are less certain. Studies from China have both found and not found an association with environmental temperature. Similarly, researchers report no effect of temperature and COVID-19 transmission or deaths in Australia, Spain, and Iran. However, high temperatures are associated with a lower number of cases in Turkey, Mexico, Brazil, and the United States. But it appears there is a threshold. Higher temperatures do not cause a further decline in COVID-19 transmission, which could account for some of the disparities. This is consistent with laboratory studies that show the SARS-CoV-2 virus is highly stable outside the body at 4 degrees Celsius but increasingly unstable at temperature above 37 degrees Celsius. Hours of sunshine and UV light. A study in Spain found that after 5 days of lockdown, the longer the hours of sunshine, the more cases there are of COVID-19. This positive association held true with a lag between sunshine hours and cases of 8 and 11 days. There was no link between the hours of sunshine before lockdown and during the first 5 days. This contradicts findings from influenza research, which suggest lower transmission with longer hours of sunshine. In contrast, there appears to be no effect of solar UV light, as the wavelength required to kill viruses and bacteria is under 280 nanometers. This type of UV light does not reach Earth as it is absorbed in the ozone layer. If it did reach Earth, humans would suffer severe burns to their skins and eyes within minutes. Some minor effects of UVB light, defined as 280 to 320 nanometers have been proposed to explain the contradictory findings of lower transmission of COVID-19 in cold and dry conditions at a higher altitude. However, other factors such as higher vitamin D levels within people in these regions might be more important. Controversy. Researchers in Oxford, England list reasons why people should not use observational studies on the number of COVID-19 cases and associated weather conditions to establish the seasonality of COVID-19 transmission. They argue that testing capacity has been a major problem in most countries, which means there are many more cases than are reported. Therefore, any factor linked to the weather and increased chances of testing could make it seem like the number of cases was due to weather, while increased testing is simply driving the numbers. For example, other respiratory illnesses are common in winter months and could prompt people to have a test for COVID-19. Milder cases will be identified, which would not have come to light without another virus's respiratory symptoms. Furthermore, other conditions such as cardiovascular diseases are more common in cold weather. Patients who present at the hospital are more likely to be tested, which leads to further identification of cases. However, this would be related to other conditions linked to the weather and not necessarily COVID-19. Nevertheless, COVID-19 deaths are less likely to be confounded by testing capacity, since those with severe symptoms are expected to attempt the hospital independently of the weather. Some studies above report an association between deaths and changes in the weather. During a pandemic, a new virus will spread rapidly through a population where no one has immunity. Researchers at Princeton University and the National Institutes of Health have modeled the spread of SARS-CoV-2 in relation to the weather using data on two beta coronaviruses similar to SARS-CoV-2, which usually cause the common cold. They found pandemic transmission in the community was likely to be so strong it would negate the minor effects of weather changes such as high temperatures and humidity. The model explains why some countries with weak public health control measures such as avoiding close contact, closed spaces and crowds, and where this is not possible, wearing masks, are showing high transmission rates in the hot and humid summer conditions. A new study explores COVID-19 severity and weather. To overcome the problem of non-weather factors that confuse the picture of seasonality and COVID-19, an international group of researchers has analyzed the severity of COVID-19 instead of the number of cases. Using data from admissions to 6 European hospitals and 13 hospitals in the Zhejiang province in China, they found decreases in deaths, the average length of stay, and admission to intensive care units for COVID-19 with each additional day of the pandemic. This was found in most of the European hospitals but not the Chinese hospitals. Deaths decreased in the European hospitals with each unit of temperature increase but not in the Chinese hospitals. They hypothesize the decrease in severity is related to humidity-driven changes in nasal mucus and viral clearance by nasal cilia. The findings of decreasing severity are corroborated in their US and UK data set of 4 million citizens self-reporting systems associated with COVID-19. Over 37,000 people had a symptom cluster with a close correlation to positive COVID-19 testing. There was a similar decrease in symptom duration across the course of the study. What this study means: this research is a preprint and observational study. Therefore, it cannot establish causal links, but it does go some way to overcome the potential confounding factors in earlier weather and COVID-19 case studies. If COVID-19 is seasonal, experts will likely establish this in 2021 or 2022 after the main pandemic waves. In the meantime, the authors suggest the importance of considering hydration for patients and the public, including the ancient practice of nasal irrigation.